Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Did you know that April is Alcohol Awareness Month? And did you know that today, April 7th, is World Health Day? Make no mistake, these two events are related. Worldwide, 3 million deaths result from harmful alcohol use. That's 5% of the world's population. But if you're younger, age 20 to 39, it's almost triple. 13% of deaths are related to alcohol. At-risk drinking and alcohol addiction can affect anybody, from celebrities like Brad Pitt, Jamie Lee Curtis, and Colin Farrell, to your aunt, my uncle, and everyone in between. Alcoholism is a major public health problem. In today's episode, I'll talk about 5 key things you need to know about alcohol addiction. Let's get started. Number 1, alcohol addiction is a chronic disease. Alcohol use disorder, or AUD, is a chronic medical condition where a person is unable to stop or control their alcohol consumption despite harmful health, social, or occupational consequences. Long-term excess drinking can cause changes to the brain that impair a person's habits, behaviors, decision-making ability, mood, and overall mental health. Unfortunately, people experiencing alcohol addiction are highly stigmatized, judged, and shamed. Stigma acts as a major barrier to care. Make no mistake, alcohol addiction is not a sign of moral weakness or failure. The good news is that treatment is available, and most people who access treatment get better. More on that later. Number 2, excess alcohol consumption can harm every part of your body and your life too. Too much booze can cause injuries such as car accidents, falls, drownings, and burns. It's also associated with violence, including homicide, suicide, and sexual assault, as well as risky sexual behaviors, including unprotected sex, unintended pregnancy, or sexually transmitted illnesses like HIV. Alcohol can also damage every organ system, from heart disease and stroke to liver disease, digestive problems, and cancer of the mouth, throat, colon, and breast. Alcohol also weakens your immune system and increases your risk of mental health problems such as depression and anxiety. Number 3, know how to identify a standard drink and excessive drinking. In the US, a standard drink contains 0.6 ounces or 14 grams or 1.2 tablespoons of pure alcohol, which you'll typically find in 12 ounces of beer, which is 5% alcohol, 8 ounces of malt liquor, which is 7% alcohol, 5 ounces of wine, which is 12% alcohol, and 1.5 ounces of 80 proof distilled spirits or liquor, which is 40% alcohol, such as whiskey, vodka, rum, or gin. And so what's excessive drinking? It includes binge drinking. For women, this is 4 or more drinks in one occasion. For men, it's 5 or more drinks in one occasion. Excessive drinking also includes heavy drinking. For women, this is 8 or more drinks per week, and for men, it's 15 or more drinks per week. Note that any alcohol consumption by pregnant women or people under age 21 in the US is considered excessive drinking. Number 4, many famous musicians are in long-term recovery from alcohol addiction. Rock and roll has a long history with booze. The money, the fame, the pressure to write hit songs, and the high pressure to travel and perform can create a high-stress, pressure cooker lifestyle, and alcohol can relieve that stress and pain, at least in the short term. Elton John, Tim McGraw, Eminem, Beatles legend Ringo Starr are just a few musical superstars who successfully overcame their unhealthy relationship with alcohol. Canadian rock star legend Neil Young stopped drinking over a decade ago. He said, "I did it for 40 years," before writing his memoir. Aerosmith's Steven Tyler and Joe Perry quit drinking many years ago. In fact, Tyler and fellow musician Richard Supa co-founded Recovery Unplugged, which incorporates music into the healing process. Number 5, treatment is available. The good news is that most people with alcohol use disorder, once connected to the appropriate treatment recovery services, get better. 3 FDA-approved medications reduce cravings and the risk of relapse: naltrexone, acamprosate, and disulfiram. Naltrexone, taken as a daily pill or a monthly injection, has been shown to be most effective in reducing cravings for and pleasure from alcohol. Behavioral therapies are also evidence-based treatments aimed at changing drinking behavior through counseling, and they're led by trained professionals. And they include cognitive behavioral therapy, or CBT, and motivational interviewing, or MI. Mutual support groups such as Alcoholics Anonymous, or AA, and other 12-step programs provide peer support for people wanting to cut back or quit. These programs, when combined with medications and behavioral therapies, can provide an added layer of support. I'll conclude by saying that alcohol addiction is a serious health issue that requires professional treatment and support, much like any other health problem such as diabetes or Parkinson's disease. Like most chronic conditions, relapse or return to use is expected. Recovery from alcohol addiction is a lifelong process, requiring ongoing support, monitoring, and lifestyle changes, including healthy eating, regular exercise, and mindful practice such as meditation. So how can you get involved? If you or someone you know is struggling with alcohol addiction, get help. Find a primary care provider, an addiction medicine doctor or psychiatrist, psychologist, or a clinical social worker, as well as supportive family and friends. You can also learn from reliable sites like the CDC, ASAM, AAAP, NIDA, NIAAA, SAMHSA, as well as Alcoholics Anonymous, or AA, Smart Recovery, Women for Sobriety, and many others. Well, that's all for today. Here's your joke of the day, spring themed. Did you know that we prank each other on April 1st? Yes, I'm fully aware. Be sure to subscribe to my YouTube channel, write comments below, and follow my Instagram at Health Humor Harmony Dr. Roy. Be well, I'll see you soon.